Follow these simple aftercare instructions for the successful healing of your ear or cartilage piercing. Be certain to avoid touching your new piercing, unless of course you are about to clean it. Make sure to wash your hands immediately before beginning any aftercare cleansing procedure, jewelry removal, or installation. Avoid using harsh, irritating cleaners for aftercare cleansers, such as isopropyl rubbing alcohol or hydrogen peroxide. Starting the day after the initial piercing procedure, clean the piercing 2 times a day. Apply the aftercare solution provided to the front and back of each piercing. Apply the solution directly from the bottle. A small cloth may be placed under the ear to avoid excessive solution from running down onto the neck area. After allowing the solution to saturate the ear piercing site, gently grasp the front of the jewelry and rotate or slide back and forth. Do this procedure for each ear. Only 2 drops of solution are needed per ear. 1 application drop in the front of the ear and 1 applied to the back of the ear. During the initial healing period, a dead cell waste accumulation can often occur on the back of the jewelry. Your own bath, shampoo, or shower water running over the piercing is fine and actually can help remove the dead cell waste that can accumulate on the back of the piercing jewelry. The use of an organic Castile soap is an excellent way to remove dead cell waste accumulation. Organic alternative cleansing methods can include organic peppermint or tea tree oil Castile soaps, which are very gentle and effective cleansers that can safely dissolve, remove, and float away dried and encrusted cell waste accumulation that can occur on the backside of the jewelry. To use, soak the piercing in very warm water and apply the soap to the front and back of the ear piercing. Then rotate or move back and forth. Apply compression to the front and back of the ear piercing site. Then rinse and dry. A warm sea salt compress or sterile sea salt spray misted onto any piercing site 2 times daily can be very effective for healing and soothing an aggravated piercing. All aftercare methods can be followed by applying virgin organic coconut oil 2 times daily with a fresh applicator. Do not remove the jewelry during the initial healing period. Continue cleaning the piercing 2 times a day for 6 to 8 weeks, 6 to 9 months for cartilage. If it is decided to change out the ear piercing jewelry to another style at the 6-week period, then continue with the cleansing procedure for an additional 2 weeks after the jewelry change. If it is decided that the original ear piercing jewelry style is to be worn long term, then remove it at the 6 to 8 week period to clean the jewelry. Upon removal, put the jewelry in a small shallow tray and wash the jewelry in soap and water. Then rinse with fresh water, taking great care not to drop your jewelry. Gently wipe the surrounding ear piercing site with the appropriately selected solution and install your freshly cleaned or new jewelry back into the ear piercing site. Avoid knitted, mesh, terry, crocheted, and other loopy items and materials that can present snagging hazards to your jewelry. Take extra care when removing clothing over the head by making sure the neck portion is wide enough to accommodate the new piercings. If the jewelry has accidentally been removed, then immediately follow the procedures just mentioned and reinstall the jewelry. Please do not wait to contact babyearpiercing.com if unexpected removal or loss occurs. The jewelry used at babyearpiercing.com is found to be secure and usually does not disengage on its own unless it has suffered damages. Physical actions and elements affecting the jewelry, such as unexpected force, element, chemical, cosmetic exposure, and gradual physical wear can have possible effects on the durability, performance, aesthetic appeal, and longevity of any jewelry. Check jewelry regularly for security and always replace the backs or any other pieces after any unexpected disengagement occurs or as often as needed, especially when jewelry exhibits signs of wear, weakness, or misshape. As a result, jewelry repair services are needed for diamonds and gemstones that may have become loose in a setting. The ear-piercing jewelry used for services at babyearpiercing.com is found to be very durable, though it is not indestructible. Swimming with new piercings. If you must go swimming with your new piercing during the initial healing period, then you must attempt to totally protect it. You can use a waterproof patch. There are no guarantees that this product will keep your piercing 100% dry, though most guests that have used the patch report that it kept their piercings dry. This important information is being revealed to you as preventative measures to avoid general ear piercing aftercare emergencies and panic. The success rate of ear piercing aftercare at babyearpiercing.com and reports of minor complications are well below an amazing 1%. Rare, but still a possibility, any signs of irritations occurring within 3 days of the initial ear piercing service or even much later may indicate an extreme hypersensitive condition, an allergic reactive condition, or possibly the start of an infection. If a hot, heated, and swollen ear is observed, begin by checking the metal type, style, and length of the jewelry installed. Generally, all ear piercing jewelry used at babyearpiercing.com has enough length on the post to accommodate a small degree of swelling that naturally occurs with every ear piercing within the first few days or after. During the ear piercing service, each earring back will be set into the proper position. It is important to make certain that the back of the earring is not too tight. An earring back that is put on too tight can mimic an irritation, allergic reaction, or infection. For backings that are fully covered, the designated back space is preset and the earring backs cannot be pushed down the post. For open, flat backings that push on and pull off, or push on and thread off, it is imperative that the backs are not pushed on too tight. Generally, the earring backing should be placed on the notch inscribed on the post. If it's the threaded style of jewelry, which will not have a notch inscribed on the post tip should never protrude beyond the jewelry backing piece. If it is, and swelling is present, then move the backing piece into the proper position. If this maneuver has caused extra room, then the swelling should subside. If the back of the ear jewelry is in its proper position and the ear has swelled enough to take up the entire length of the jewelry, immediate removal is required. A warm sea salt compress at this time can be helpful. The removal of the jewelry will most likely relieve the ear of its restriction, and that ear should return to near normal in 3 to 12 hours. A physician should be notified for advice on symptoms and especially for conditions that show no improvements in this time frame and after. Remember, most piercings can be reinstalled, making the issue of jewelry removal an easy choice. It is very important that you install a retainer if you are in a situation where you are unable to wear your jewelry during the first year and sometimes even well after. Your ear piercing will take 6 to 8 weeks and cartilage 6 to 9 months to initially heal and 1 year or more to completely heal. Even after 1 year, if your piercing is taken out for a short period of time, such as 5 minutes, a few hours, or even overnight, insertion may seem impossible. If your jewelry is lost, taken out, forgot to be installed, or is having a healing issue and needs to be unwillingly removed, relax. Even after years gone by, most often a select piercing that seems closed can be successfully reopened. This aftercare information was compiled from years of experience and has proven to be useful as an aid of ensuring that your ear piercing has the best chances of successfully healing. Wearing ear piercing jewelry should be an experience that creates beauty, excitement, and uniqueness. I have found through years of experience that these particular metals, jewelry styles, and aftercare methods mentioned work best for the type of piercings that I perform on guests at Paisley House for babyearpiercing.com and diamondearpiercing.com. Due to certain individual skin types or sensitivities, these particular metals, jewelry styles, and care products mentioned may not be the right choice or work for everyone. If you experience redness, swelling, irritation, or other irregular conditions that are related to your piercing, discontinue the use of the product and or remove the jewelry and seek the advice of a qualified physician if conditions and symptoms worsen or persist. If you believe you may be suffering from a life-threatening situation related to your piercing, call 911 or go to the nearest emergency services facility.